So um, I'll be joining the daily highlights and acting as a moderator and as a product manager from Condair. My name is Graham Holmes. I'll be here with Dr. Stephanie Taylor each day. Um, Today we're going to be focusing on surface and hand hygiene and how humidity affects that world. We recently got news this morning that Boris Johnson has been infected with COVID-19. This has been after that he has posted comments about continuing to do handshakes and not truly avoiding the social distancing. So we're going to be talking about the importance of that as well and how humidity has an effect in there. So with that, Stephanie, I'll turn it over to you to kind of elaborate on those topics.
So good morning, everyone, and I apologize if you saw any technical glitches. So right now, we're all encouraged to stay home or mandated to stay home, and there's certain strategies in place to decrease transmission of the SARS-CoV-2 virus. And as Graham said, part of that is reducing our contact with other people, hand hygiene, cough and sneeze etiquette, staying 6 feet apart at least, doing the elbow bump. I think that may be still allowed, although I guess you'd have to have a pretty long elbow. But anyway, so in addition to those strategies to decrease contact transmission, we can also actively manage our indoor environment through adding proper amounts of water vapor to achieve relative humidity levels of 40%. And thankfully, this added dimension of managing our indoor environment with humidification actually enhances the other strategies that the CDC and the World Health Organization are very energetically advocating. So how does that work? So when you humidify the air, you actually are doing a couple things that are beneficial for our health. Number one, you decrease the burden of viruses, of infectious viruses in the air. You bring them down onto surfaces. So when you clean the surface, you effectively increase the hygiene of your home. Compared to with dry air, you have resettling of contaminated aerosols from the air onto surfaces, onto your hands and surfaces. So when the air is dry, despite surface cleaning and hand hygiene, you can get recontaminated, or your home surfaces can be recontaminated and you don't even know that that's happening. So humidification increases the effectiveness of that strategy. So Graham has just put this image up. So over on the left side of your screen, you see a situation. This is in say a hospital. Somebody comes into a room and coughs. If that person is sick, the droplets that leave their airways are going to be spread up into the air as infectious aerosols. And we know that COVID-19 is transmitted through infectious aerosols. So in dry air, the droplets shrink very rapidly. And once they reach a very small size of 0.5 microns, they spread through the air, through your HVAC system, through air conditioning, out the window and back in another window, very effectively. In addition, as you can see in this diagram, any viral particles that land on surfaces, as I just said, can be resuspended and then recontaminate the surface or your hands. So in the center of this image, you see in the circle, this is a description of how water vapor, not liquid water, but water vapor actually gloms onto airborne particles and existing droplets and brings them out of the air. And in doing so, number one, it cleans the air of these infectious aerosols. It keeps things settled down so that once you wipe away a surface or wash your hands, you've effectively cleaned those things, your hands, the surfaces. And thirdly, we now know that our immune system works much better. Our respiratory immune system is much more effective when the ambient relative humidity is around 50% than say at 20%. So the message that Graham and I are hoping to convey to you this morning is that keep on doing the things that we've been recommended to do. Keep on maintaining surface and hand hygiene. But when you humidify your air, it's like as Graham said, it's a multiplier effect of cleanliness.
Yeah, so Stephanie, you're talking about the dry air condition versus a more humidified condition and settling times of particles. Do you have kind of like a time frame for how long it would take in dry air versus how long it would take in, say 40 to 60% relative humidity?
I mean, that's a great question, Graham. It depends on some other factors as well, such as air turbulence, but in general, the settling of particles in well humidified air occurs within a fraction of a second. Again, depending on the air velocity and turbulence, but really within half a second to a second.
So we've been told, yeah. So right now, at least in Canada, the general distance we're supposed to keep with social distancing is about 3 to 6 meters between other people. So
3 feet, I think.
Yeah, 3 to 6 feet. Sorry. So in a dry air condition, if it's able to be suspended for hours or longer, is that distancing still effective, or do we truly need to be in a more humidified scenario for that?
I mean, that's a great question, Graham. And for 1 to 2 meter distancing to really be effective, we need to be in 40 to 60% relative humidity. Otherwise, at 20% relative humidity, droplets will come from a person's cough, for example, and some of them will settle quickly, some of the very large mucus droplets, but way too many will shrink and then be disseminated through the air, through your home, way further than 1 to 2 meters. So for those recommendations to be fully effective, we need to be in the ideal 40 to 60% relative humidity range.
So then that also extends to things like surface cleaning and washing your hands, right? So any sort of having those recontaminated surface spring up again by, different actions that we're doing, like cleaning the table or something like that, that resettling time comes into effect again. So it sounds like controlling that environment and, the actual cleanliness of the air and humidity of the air is kind of like a multiplying factor on all these other defense or precautionary defenses we're using and strategies. Is that correct?
That's absolutely correct. So by humidifying your air, you're effectively cleaning surfaces, your hands are cleaned, and they remain clean. So yes, humidifying your air enhances the strategies that were already recommended to do.
Okay. So it sounds like it's not just this is the only solution, but it sounds like here's another thing that we can do at home to be proactive in this this fight against this new virus and other viruses, seasonal viruses throughout each year.
Absolutely. And washing your hands and cleaning surfaces doesn't benefit your immune system per se. And the additional advantage of humidifying your air is you're also supporting the function of your respiratory barriers.
Mm-hmm. Okay, so what are you recommending right now for people to go out and get humidifiers? Is it something we should be looking at for the entire building? Is it something we should be doing with personal humidifiers at home? What kind of short-term, long-term plan is available here?
So Graham, you're the expert on humidifying systems, not me, but I can tell you anything we can do to raise indoor relative humidity towards that 40 to 60 zone will be beneficial. Unfortunately, we didn't, a lot of people didn't get this message before this COVID-19 outbreak occurred. But now that we're in the midst of it, it might be hard to get a whole installation system. Many people will say that they don't want to budget that right now. So anything you can do would be beneficial. But I also think this time now when we're not at work, our children aren't at school, this is a time where we really need to make interventions in public buildings to humidify, for the biological reason of decreasing disease transmission, and also to tell people, to show people, building owners care about the health of the workers, the health of occupants. So I think right now is a key window to begin to implement strategies to humidify whole buildings. But Graham, that's something that you are the expert on.
Yeah. So Condair, as a company, we offer full across-the-board installations for these long-term solutions that you're talking about. We're the only company that has every different type of humidifier available on the market, and we have some humidifiers that nobody else has as well. We have a big focus on hygiene and occupant safety as well. We're making a real push into the healthcare sector and making sure that our units are easily maintainable and safe to operate as well. So when you're mentioning those long-term solutions, the Condair product line is a great spot to start and for those ones. But for the interim on the temporary units, we highly suggest humidifying as well as you can, like you were mentioning, and anything you can really get going.
Yeah. So several years ago, I happened to install a Condair RH2 steam humidifier in my home. And prior to that, my family members were getting sick every year, colds, occasionally the flu. And in the last 4 years since we installed that system, we have not had a single illness. So I'm going to keep my fingers crossed and hope that continues right now.
Okay, I think that wraps up the topics that we wanted to touch on today. Stephanie, do you have anything else to add?
No, I just hope everyone has a good weekend and stays calm and come back on Monday, 10:30 Eastern time.
Yeah. Okay, thanks everyone for joining us. And stay safe at home, and good luck to everybody. Thank you.
Take care. Bye.